Fever in children. What is a fever? A fever is defined by most healthcare providers as a temperature of 38 degrees Celsius and higher when taken directly. The body has several ways to maintain normal body temperature. The organs involved in helping with the temperature regulation include brain, skin, muscle, and blood vessels. Body responds to changes in the temperature by increasing or decreasing sweat production, moving blood away from or closer to the surface of the skin, getting rid or holding on to water in the body, seeking a cooler or warmer environment. When your child has a fever, the body works the same way to control the temperature, but it has temporarily reset its thermostat at a higher temperature. Temperature increases for a number of reasons. Chemicals called cytokines and mediators are made in the body in response to an invasion from a microorganism, malignancy, or the other intruder. The body is making more macrophages. These cells that go to combat with intruders are present in the body. These cells actually eat up the invading organism. The body is busy trying to make neutral antibodies which fight infection. These antibodies will recognize the infection next time if it tries to invade. Many bacteria are enclosed in an overcoat-like membrane. When this membrane is disrupted or broken, the contents that escape can be toxic to the body. They stimulate the brain to raise the temperature. What condition can cause a fever? The conditions that cause fever are infectious disease, certain medicines, heart stroke, blood transfusion, disorders in the brain, some kinds of cancer, some autoimmune disorders. What are the benefits of a fever? Fever is not an illness. It is a symptom or sign that a body is fighting an illness or infection. Fever stimulates the body defenses, sending white blood cells and other fighter cells to fight and destroy the cause of an infection. What are the symptoms that my child may have a fever? Children with fever may become more uncomfortable as the temperature rises. Along with the body temperature greater than 38 degrees Celsius, symptoms may include your child may not be active or talkative as usual. Your child may be fusier, less hungry, and thirstier. Your child may feel warm or hot. Remember that even if your child feels like he or she is burning up, the measured temperature may not be that high. The symptoms of fever may look like other health conditions. According to American Academy of Pediatrics, if your child is younger than 3 months of age and has a temperature of 38 degrees Celsius or higher, you should call your child's healthcare provider right away. If you are unsure, always check with your child's healthcare provider for a diagnosis. How should a fever be treated? In children, a fever that is making them uncomfortable should be treated. Treating your child's fever will not help them to get rid of the infection any further. It simply will relieve discomfort linked to the fever. Children between the ages of 6 months and 5 years can develop seizures from fever. That is called febrile seizures. If your child does have a febrile seizure, there is a chance that seizure may occur again. Usually, children outgrow the febrile seizure. A febrile seizure does not mean your child has epilepsy. There is no evidence that treating the fever will reduce the risk of having febrile seizure. What can I do to decrease my child's fever? Give your child an anti-fever medicine such as acetaminophen or ibuprofen. Don't give your child aspirin. It has been linked to serious potentially fatal disease called Reye syndrome. Other ways to reduce fever. Dress your child lightly. Excess clothing will trap the body heat and cause temperature rise. Encourage your child to drink plenty of fluids such as water and juices. Give your child a lukewarm bath. Do not allow your child to shiver from a cold water. It can raise the body temperature. Never leave your child unattended in the bathtub. Don't use alcohol baths. When should I call my child's healthcare provider? Unless advised otherwise by a child care provider, call the provider right away if your child is 3 months old or younger, has a fever of 38 degrees Celsius or higher. Get the medical care right away. Fever in a young baby can be a sign of dangerous infection. Your child is of any age and has repeated fever above 40 degrees Celsius. Your child is younger than 2 years of age and has a fever of 38 degrees Celsius that lasts for more than 1 day. Your child is 2 or older and has a fever of 30 degrees Celsius that lasts for more than 3 days. Baby is fusy or cries and can't be soothed.